My name is Toni Maddox, and I am a RN case manager with Restore Home Health. What inspired me to work in nursing is the ability to be able to help people. I've always liked the idea of knowing that being a nurse, I would be able to help people, provide care, and also knowing that I would always have a job no matter what. There's always a setting for nurses, and I would always be able to go to work. Home health nursing differs from any other nursing care that I've given in the aspect of being in the patient's home. They're a little more comfortable with the care that they're receiving because they're in a more comfortable environment. Nursing-wise, though, you don't have access to, immediate access to doctors and other nurses and aides. Whenever you need assistance, you have to go into the home prepared. You never know what kind of environment you're going to go into whenever you first go to start a patient. But overall, they're in a setting where they're a little more comfortable with being open to you. It's more of a family environment because they welcome you into their home. They allow you to come in and take care of them, and they're not as nervous where they are in a hospital setting or a doctor's office. They're a little more comfortable in the home setting. What I enjoy most about home health nursing is the fact that I do get to go into people's homes. It's completely different than going into a hospital and knocking on a door and asking to see the patient. You go into their home, you get to know them, you get to know their family, you get to see a different side of the patients than you do in the hospital or doctor's office setting, and I enjoy that. Restore provides an environment where I can do my job well by taking the team approach. We have a great administration, great office staff, great field nurses. There's always access to somebody in the office, somebody that can help you, somebody that can answer questions, make a phone call. They take a team approach, and that really helps me be able to do my job a lot better because I know that I'm never alone, even when I am. There's always somebody there to help if I need it. A specific patient that I helped in their healing process was a patient who was a newly diagnosed diabetic patient. She had never known how to use a glucometer, how to use or how to draw up insulin or give her own injections. She was basically clueless. She needed education from top to bottom, and I think that once we got her started on services and got her a plan of care developed, that myself and the other LPNs that went in to see her and help take care of her provided education on everything from the disease process to the medication that she was receiving, how to check her blood sugar, diet, everything that you would need to know about being a diabetic patient. And she went from not being able to even check her blood sugar to being able to check her blood sugar, draw up her insulin, give her own injections, and she would do this willingly and be very prepared. Every time I would go in to see her, or other nurses would go in to see her as well, and I think she felt just as rewarded about learning about her disease process as we did, knowing that we helped her in becoming able to manage her diabetes. Would I recommend Restore Home Health to others? Absolutely. We take a team approach in our care that we give to patients. Each patient is treated individually. We take a holistic approach. We don't just go in and say this is what we're here for and leave it at that. We go in and we take care of everything, and I would absolutely recommend Restore Home Health to others.